Have you ever had one of those nights where your body is completely exhausted, but the moment your head hits the pillow, your brain just refuses to shut down? You lie there watching the clock turn from 1 a.m. to 2 a.m., feeling that subtle, restless buzz in your legs. Or maybe you wake up in the middle of the night with a sudden, painful cramp in your calf. If that sounds like your typical week, I want you to take a deep breath because you are definitely not alone. In my clinical experience, these aren't just random symptoms of getting older or having a busy lifestyle. More often than not, they are your body's subtle cries for one missing piece of the puzzle: magnesium. In fact, modern medical research suggests that up to 80% of adults live with a subclinical magnesium deficiency. And here's the kicker: your routine annual blood test won't usually show it. Why? Because less than 1% of the magnesium in your body actually stays in your bloodstream. The other 99% is stored deep inside your bones, muscles, and tissues. So your blood work can look perfectly normal, while your cells are practically starving for it. Welcome back to the channel. I'm Dr. Gulnar. Today, we're going to cut through all the confusing supplement marketing, look at what's happening inside your cells, and break down exactly which form of magnesium will actually help you sleep better, recover faster, and calm your nervous system. To really understand why magnesium is such a game changer, let's take a quick look under the hood. I like to call magnesium the body's ultimate relaxation conductor. It's involved in over 300 essential biochemical reactions every single day, but it has two main jobs that dictate how you feel when you wake up in the morning. First, let's talk about your brain and nervous system. Your brain uses chemical messengers called neurotransmitters. One of the most important ones is GABA, which is basically your brain's natural emergency brake. GABA tells your thoughts to slow down, lowers your heart rate, and signals to your body that it's safe to rest. But here's the secret: GABA cannot properly bind to its receptors without adequate magnesium. When your magnesium levels are low, your brain stays in a mild state of hyperarousal. That's why you feel wired but tired. Second, let's look at your muscles. Every time you move, work out, or walk, your muscle cells use calcium to contract. Calcium acts like the gas pedal. It turns the muscle on. But to turn that muscle off and let it relax, your body needs magnesium to push that calcium back out of the cell. If you don't have enough magnesium, calcium floods your muscle cells unchecked. The result? Persistent tightness, muscle twitches, post-workout soreness that lasts for days, and those agonizing nighttime leg cramps. Now, this is where most people get stuck. You walk into a pharmacy or open an online store, type in magnesium, and you're flooded with a dozen different options: glycinate, citrate, malate, oxide. It's overwhelming. Here is what you need to know: raw magnesium cannot be absorbed on its own. It has to be bound or collated to another molecule, like an amino acid or an organic acid, and that molecule completely changes where the magnesium goes in your body and what it actually does. Let's break down the three most effective forms so you know exactly what to buy. First, magnesium glycinate. This is the ultimate sleep and anxiety solution. In this form, magnesium is bound to glycine, an amino acid that has its own powerful calming effect on the central nervous system. Because glycine easily crosses the blood-brain barrier, magnesium glycinate is widely considered the gold standard for long-term sleep architecture, reducing brain fog and easing chronic anxiety. The best part? It's exceptionally gentle on your stomach and won't cause digestive upset. Second, magnesium malate. This is best for energy, stiffness, and muscle soreness. Here, magnesium is paired with malic acid, a compound naturally found in fruits that plays a key role in your cellular energy cycle. If you suffer from daytime fatigue, muscle stiffness, post-workout soreness, or conditions like fibromyalgia, malate is fantastic. It relaxes tight tissue while supporting cellular stamina without making you feel drowsy. Third, Magnesium citrate. This works great for digestive health and gentle relaxation. Bound to citric acid, this is one of the most common and easily absorbed forms on the market. However, citric acid draws water directly into your lower digestive tract. In small doses, it's great for overall magnesium intake, but in higher doses, it acts as a mild laxative. If you struggle with sluggish digestion or occasional constipation alongside muscle tightness, citrate is an excellent dual-purpose choice. So, how do you actually incorporate this into your daily routine like a medical professional? First, timing matters. Magnesium is largely a dusk mineral. If your primary goal is better sleep quality and stress relief, take magnesium glycinate roughly 30 to 60 minutes before bed. If you're taking magnesium malate for daytime energy and muscle recovery, take it in the morning alongside your breakfast. Second, target dosage. For most adults, a supplemental dose of 200 to 400 milligrams of elemental magnesium per day is the sweet spot. Always read the back of the label carefully. Make sure you are looking at the amount of elemental magnesium, not just the total weight of the pill. Third, food first. Supplements should supplement a healthy diet, not replace it. Keep your plate rich in pumpkin seeds, dark leafy greens like spinach, dark chocolate with 70% cocoa or higher, almonds, and avocados. Before you go out and start supplementing, we need to talk about safety and synergy, because vitamins and minerals never work in isolation. Did you know that your body cannot properly activate and process vitamin D without adequate magnesium? If you are taking high-dose vitamin D3 supplements without magnesium, you might actually be depleting your magnesium reserves even faster. Furthermore, pairing your magnesium with vitamin B6 acts like a cellular key, helping transport the mineral directly inside your cells more efficiently. Now for medical precautions. If you have chronic kidney disease or renal impairment, you must consult your physician before taking any magnesium supplement. Your kidneys filter excess minerals, and impaired kidneys can lead to dangerous buildups. Additionally, if you are taking antibiotics or thyroid medication, space your magnesium intake at least 2 to 4 hours apart, as it can bind to those medications and stop your body from absorbing them. Finally, let's address the big debate that always pops up in the comment section. Is there really a difference between cheap drugstore magnesium and professional-grade supplements? As a clinician, I have to tell you, form matters far more than brand hype. Many cheap off-the-shelf drugstore supplements use magnesium oxide. Why? Because it's cheap to manufacture. But clinical studies show that magnesium oxide has an absorption rate as low as 4%. That means 96% of what you swallowed passes straight through your digestive tract, often causing diarrhea and stomach cramps without ever reaching your muscles or your brain. When you invest in a quality supplement, you are paying for bioavailability. Forms like pure chelated glycinate, malate, or threonate that your body can actually absorb and utilize at the cellular level. I'd love to hear from you. Have you noticed a difference in your sleep or muscle recovery after taking magnesium? Which form are you currently using? Drop your thoughts and questions in the comments below. I read through them to help plan our future topics. If you found today's medical breakdown helpful, please hit that like button, subscribe to the channel, and share this video with a friend or family member who could use a good night's sleep. Thank you for watching, stay healthy, and I will see you in the next video.